If someone can endure a certain kind of pain, then knee joint pain is an entirely different story. For many people, knee pain is like a chronic illness, an obsessive, lingering, persistent kind of suffering, and sometimes it makes people no longer want to walk at all. So what kinds of knee joint conditions do we commonly encounter, and why has knee pain become such an obsession for so many people? The knee joint is one of the most complex joints in the human body. Any problem occurring in any part of the musculoskeletal system can cause knee pain. It is not only older adults who suffer from knee pain, even young people can experience this condition. Some people begin to feel that something is wrong with their knees when they are just over 30. Some people consider it normal by the time they are 40. And by 50 or 60, many people accept that knee pain is an inevitable part of old age. Looking at the group of people who follow health-related programs, it can be seen that the age range stretches from around the early 30s to over 60, in which older people account for a not insignificant proportion. This shows that knee pain is not a story belonging to any one person alone, nor does it appear only in a certain age group. Therefore, correctly understanding knee pain, understanding its causes, understanding how to detect it early, and understanding how to protect the knee joint is very necessary. The questions raised are: what are the causes of knee pain? How can we detect knee problems as early as possible? How should we exercise so as not to injure the knees? And how should we protect the knees to avoid consequences later on? When building content around the topic of knee pain, many questions have been asked, because this is a problem that is both familiar and complex, and it directly affects the quality of life of a great many people. Among those questions, the first question that many people care about is, in which knee joint diseases is knee pain commonly seen? This is an important starting point, because if we do not understand what kinds of problems the knee can have, we can easily treat in the wrong direction or overlook early warning signs. In reality, knee pain is commonly seen in middle-aged and older people, but the current trend is that knee conditions are becoming younger. It is no longer rare for very young people to begin showing signs of osteoarthritis. There are cases in which children as young as 14 or 15 already show cartilage damage, especially damage in the patella region. This is not the classic kind of childhood arthritis as in the past, but degenerative type damage that appears very early. This shows that if from a young age, we do not understand the knee joint and do not know how to prevent and protect it, then in old age the consequences will be very severe. The knee is a large joint that bears the body's primary load, and it is also one of the most important joints. When the knee hurts, a person's life is almost completely turned upside down because walking, daily activities, and working are all seriously affected. Therefore, learning about common knee conditions is not only a matter of treatment, but more importantly a matter of prevention, to avoid movement-related disasters as age increases. There is a very specific story showing that if people do not correctly understand knee pain, they can easily make wrong decisions. About 4 weeks ago, an old acquaintance from high school called to ask about a family member who had knee pain. That family member had been examined in many places, and in the end a foreign doctor indicated that surgery was required, because according to the assessment, without surgery it could not be cured. The question was whether surgery was truly necessary. After carefully reviewing the condition, it could be seen that this was not a case that required mandatory surgery. The cause of knee pain in this case was not an injury that needed immediate surgical intervention, but rather the result of a long process from youth up to the present. It was a process of dietary deficiency in micronutrients, especially calcium and magnesium deficiency, leading to a pathological vicious cycle of inflammation and joint degeneration. When inflammation and degeneration persist, the knee joint will develop effusion, causing severe pain that makes the patient think that only surgery can solve the problem. In this case, the patient had been treated at many hospitals for nearly 2 years without improvement. When the mechanism of pain was clearly explained, the treatment direction was adjusted, focusing on proper calcium and magnesium supplementation, combined with suitable pain relief medication. After only about 3 days, the pain level decreased greatly, from 10 parts down to about 1 to 2 parts. After 1 week, the pain was basically gone. This story shows that when the pathological mechanism is not understood, patients can easily be drawn into a long, costly treatment cycle and even face the risk of unnecessary surgery. Meanwhile, if the cause is correctly understood and the essence of the problem is grasped, treatment can be much simpler. This case involved a person over 60 with knee pain and swelling due to degeneration and inflammation, caught in a tangled pathological vicious cycle. From this we can see that knee pain is not simply an isolated symptom, but is often the result of many overlapping factors over a long period of time. From a pathological perspective, the first common disease group causing knee pain is conditions related to the synovial membrane. In the knee joint, the synovial membrane plays a very important role, secreting an adequate amount of fluid to lubricate the joint. However, for various reasons such as calcium deficiency, magnesium deficiency, incorrect movement, or overuse, the synovial membrane can become chronically inflamed. When there is chronic inflammation, the synovial membrane thickens, the knee begins to swell, and the amount of fluid in the joint increases beyond normal. In the past, detecting knee effusion was often done with clinical tests such as pushing fluid from above downward and checking the patellar ballotment sign. Today, ultrasound is used more because it allows accurate assessment of synovial thickening as well as the amount of joint fluid. Chronic synovitis is a cause of very severe knee pain. Knee pain is already very uncomfortable, but when the synovial membrane is inflamed for a prolonged time, the pain can become extremely terrible, making the patient almost unable to endure it. To a certain extent, chronically inflamed synovium will develop calcium and magnesium deposition, forming crystals inside, gradually forming joint stones. The deeper cause of this phenomenon is still mainly magnesium and calcium deficiency. When stones form inside the joint destruction process occurs very quickly, within 1 to 2 years, even 3 years. The patient may fall into disability and lose the ability to walk normally. At that time, the only remaining solution is often knee replacement. Thus, the first common disease group causing knee pain is chronic synovitis, which may alternate with acute phases. And if it is not well controlled, it will lead to very severe consequences. The second common disease group causing knee pain is damage directly related to the bones of the knee joint. When talking about bone, the first thing that must be mentioned is osteoporosis. If the body lacks calcium and magnesium for a long time, the bones become weaker, bone density decreases, and this leads to joint degeneration. In such cases, knee pain is not merely pain from movement, but the result of bones and joints weakening over time. Among the causes of knee pain, knee osteoarthritis is an extremely common cause and can even be considered the most common cause. Knee osteoarthritis leads to the formation of bone spurs and osteophytes on the joint surface. In some cases, when imaging the knee, these bone spurs and osteophytes are very large and clearly visible on the film. On ultrasound, these osteophytes can be seen impinging on ligaments and the joint capsule, making the capsule and ligaments thicken, thereby causing severe pain. In such situations, to resolve the pain, doctors sometimes have to indicate surgery. Surgery in this case usually aims to grind down or shave the bone spurs and osteophytes to reduce impingement within the joint. However, even with surgery, the treatment is essentially pain relief, and it is very difficult to call it a complete cure. The third disease group relates to cartilage damage, especially the cartilage of the patella. The patella is a very special bone located in front of the knee joint. On the underside of the patella, there is a layer of cartilage that helps the patella glide smoothly within the knee during movement. The most common damage at this site is patellar chondromalacia. Patellar chondromalacia can occur at a very young age, from 12, 13, or 14 years old, as mentioned earlier. When performing movements such as climbing stairs, climbing mountains, squatting, or training exercises that require deep knee bending like squats, the knee must bear very large compressive forces. When the torso and the thigh form an acute angle, the pressure on the patella increases significantly. This pressure gradually wears down the cartilage under the patella over time. If this condition persists, the cartilage degenerates, becomes thinner, and may even be destroyed. This is why many people experience knee pain when climbing stairs, going downstairs, or engaging in strenuous activity. In addition, incorrect forms of exercise, such as excessive running, walking too much, or training with poor posture, can also cause serious damage to the patellar cartilage. Besides that, the patella can also have problems related to the ligaments that stabilize it. When the ligaments are weak or unstable, the patella shifts, causing impingement with the femur above and the tibia below. This impingement is also a cause of prolonged knee pain. In addition to cartilage and patellar damage, the synovial bursa in front of the knee can also be injured, especially in people who frequently kneel, practice martial arts, play soccer, or participate in sports with a risk of knee impact. When this area is repeatedly traumatized, the bursa becomes inflamed, leading to pain when pressing on it or when bending the knee. Thus, injuries of the patella and related structures are an important group of causes of knee pain, with very diverse manifestations and easily confused if not properly evaluated. Besides the disease groups mentioned above, there are other knee joint conditions that are also very common but often overlooked. One of them is gout. Gout is a condition of elevated uric acid in the blood, often seen in people with a diet high in protein and purines. When uric acid is high, urate crystals deposit in the joint, causing knee pain with swelling, heat, redness, and severe pain. Gout pain usually comes on very suddenly and is so intense that the patient can hardly endure it. Along with gout, there is another group called pseudogout. Pseudogout looks very similar to gout. The knee is also swollen, hot, red, and painful, but the cause is not urate crystals, but calcium deposition in cartilage tissues. Normally, cartilage is not a place where calcium deposits, but when cartilage degenerates, calcium can deposit in its outer layer, causing an inflammatory reaction and pain. To diagnose pseudogout, the doctor needs good expertise and must be able to read X-rays, core MRI, or ultrasound to detect characteristic lesions. In addition, rheumatoid arthritis and other autoimmune inflammatory arthritis diseases are also very common causes of knee pain. These are chronic diseases with a long course, causing severe joint damage and very difficult to treat. In the past, these diseases were commonly grouped under the name rheumatism, and to this day they remain a major challenge in treatment. It is not only diseases originating directly from the knee that cause pain. Many conditions in other parts of the body can also manifest as knee pain. For example, a vascular necrosis of the femoral head can cause pain radiating down to the knee joint. Lumbar disc herniation, spinal degeneration, and spinal curvature due to age or abnormal bone structure can also cause knee pain. Even injuries in the ankle joint can make the patient feel pain in the knee. The knee is a very important intermediate joint of the body, related to many movement axes and influenced by many different parts. Therefore, there are cases in which the lesion is not in the knee, but the pain is most clearly felt in the knee. Conversely, there are cases where the lesion is in the knee, yet the doctor still needs to order ultrasound or imaging in other regions to find the true cause. Besides common disease groups, there are also more specialized injuries, such as ligament tears, ligament ruptures, meniscus injuries, anterior cruciate ligament injuries, medial collateral ligament injuries, and lateral collateral ligament injuries. These are issues belonging to deeper expertise in musculoskeletal medicine, but what matters is that patients need to know that knee pain never has only one single cause, and understanding common disease groups helps prevention more effectively in old age. In the stories mentioned, one point is repeated many times: the role of calcium and magnesium in the knee. These two micronutrients are not a new topic, yet they are a foundational factor that many people overlook. In the human body, the four most important electrolytes are sodium, potassium, calcium, and magnesium. Among them, calcium and magnesium always go together and have an antagonistic yet complementary relationship. Calcium plays a role in muscle contraction, while magnesium plays a role in muscle relaxation. These two factors must always be balanced for the musculoskeletal system to function smoothly. When calcium is lacking, the body cannot contract muscles well. When magnesium is lacking, the body cannot relax muscles well. When both are lacking or imbalanced, the ligaments, joint capsule, and muscles around the knee fall into abnormal contraction and relaxation, loose, yet unevenly tense, thereby causing pain. When the knee is no longer stable, walking becomes unsteady. This instability makes the patella more likely to rub against the femur and tibia, increasing cartilage damage and accelerating osteoarthritis. This is a very common mechanism of knee pain, yet it receives less attention than it should. The second role of magnesium and calcium is directly related to inflammation. Magnesium participates in hundreds of biochemical reactions in the body, many of which relate to controlling inflammatory responses and immune system activity. When the body lacks magnesium, inflammatory reactions become more likely to flare up, and immune-mediated knee inflammation can therefore appear. Calcium and magnesium are also related to joint degeneration. Before osteoarthritis occurs, the body often goes through a stage of osteoporosis. When there is not enough calcium and magnesium, the body draws these micronutrients from the bones into the blood to maintain necessary levels. This process is strongest at night, especially around 2-3 in the morning, and that is also why many people have more knee pain at night. When calcium and magnesium are mobilized from the bones into the blood levels rise. Then, when people eat and supplement further, these micronutrients increase even more. The body is forced to regulate by moving calcium and magnesium back into tissues. However, instead of returning to bone in the correct original locations, these micronutrients tend to deposit in joints that are used a lot, especially the knee, where there is a rich blood vessel network. This deposition leads to the formation of bone spurs and sharp osteophytes that pierce the joint capsule, synovium, and ligaments, causing impingement within the joint and severe pain. This mechanism explains why prolonged calcium and magnesium deficiency leads to severe knee osteoarthritis. In the previously mentioned story of the patient over 60 with knee pain, proper calcium and magnesium supplementation, combined with suitable painkillers and adjustment of movement, helped control pain effectively. This shows that if we understand the mechanism clearly, treatment and prevention of knee pain can be proactive. Conversely, if the mechanism is not understood, patients may go from one hospital to another without solving the problem and eventually pay the price with heavy interventions. The narrator also admits that their own musculoskeletal system is not truly strong, but thanks to understanding and proactive prevention, up to the present time, they still do not have knee pain. In reality, many people just over 40 or 50 already begin to walk with difficulty, their knees crackle, and they feel pain when moving. Even though this should have been a stage where good quality of life could still be maintained with early prevention. Besides calcium and magnesium deficiency, there are many other causes leading to knee degeneration and pain that are easy to overlook. One of them is genetics. Genetics here is not a vague concept, but structural characteristics of the musculoskeletal system determined by genes. Some people are born with small knee joints, narrow joint spaces, or an unfavorable lower limb alignment. As the body grows and weight increases, but the joint structure does not correspondingly change, the load-bearing capacity of the knee becomes poorer, leading to pain and early degeneration. There are cases where people are still very young, just over 30, yet they already have prolonged knee pain. When looking at X-rays or other imaging, the joint space is clearly narrow and the joint structure is unbalanced. In these cases, even with calcium and magnesium supplementation and pain medication, pain may not improve significantly because the root cause lies in genetic factors and joint structure. The next cause is obesity. The knee must bear the entire body weight. When body mass index rises, especially above 25 and then above 30, the load on the knee increases greatly. This overload occurs every day, with every step and every movement of standing up and sitting down, quickly wearing down and injuring the knee. Age, constitution, and diet can all contribute to obesity, but what matters is that if weight is not controlled, the knee will suffer severe consequences. This is a very clear risk factor, yet it is often underestimated. Another cause is excessive activity. The knee already bears a large load when standing and walking normally. When standing onto legs, body weight is distributed to both knees. But when standing on one leg, the entire body weight is placed on only one knee. When walking or running on flat ground, each knee may bear 2 to 3 times body weight. For example, for a person weighing about 50 kilograms, each knee may have to bear a force of up to 100 to 150 kilograms. When going up stairs or climbing mountains, the knee bears even greater forces, possibly 4 to 6 times body weight. Even when going downstairs or downhill, the knee still bears very large forces, often 3 to 4 times body weight. These numbers clearly show that the knee works under extremely high pressure. Many people believe that the more you exercise, the better it is for health. However, if activity is excessive or not appropriate for one's condition, the knee will be overloaded. Many athletes compete very well when young, but in old age they face severe knee osteoarthritis and prolonged pain. In addition, exercising incorrectly is also an important cause. Exercises such as squats, climbing many stairs, or deep knee bending, if performed with poor technique, create unfavorable force angles for the knee. When the angle between the torso and thigh becomes too acute, or the angle between the thigh and lower leg becomes too large, compressive forces on the patella and joint surfaces increase greatly, causing cartilage to wear down quickly. Not only the knee, but other joints such as the ankle and hip can also be affected when exercising incorrectly. Many trainers may be formally trained in sports technique, but may not deeply understand the biological mechanisms of the musculoskeletal system, leading to guidance that is not truly safe for trainees. All these factors show that exercise is necessary, but it must be done correctly, at the right level, and suitable for each individual's condition. Otherwise, instead of protecting health, we inadvertently push the knee into the risk of early injury. Besides excessive and incorrect activity, there is another group of causes directly related to the living environment and daily habits that many people do not notice. The knee is very sensitive to weather changes, especially humidity and temperature. When the weather suddenly becomes cold or humidity increases, the knee is more likely to hurt, especially in people who already have underlying damage. Many people tell each other that those with knee pain should avoid funerals and avoid weddings, but in fact the issue is not the funeral or the wedding itself, but the environmental space. Places crowded with people usually have higher humidity due to breath, sweat, and heat emitted from many bodies. Funerals often take place in small, enclosed spaces with little ventilation, so humidity tends to rise faster. Weddings are often held in larger, more open halls with fans and ventilation, so humidity may be lower. But if the space is crowded and airless, it can still cause similar effects. The core issue is that people with knee pain should limit prolonged time in enclosed, crowded, high humidity spaces. If participation is unavoidable, they should reduce exposure time, find a well-ventilated place, avoid sitting in one posture for too long, and keep the knee warm to reduce pain. In addition, another common misconception is that many people believe that to detect knee disease they must use advanced diagnostic methods such as CORE or MRI. In reality, in diagnosing musculoskeletal diseases in general and knee conditions in particular, careful clinical examination combined with X-rays and ultrasound is enough to evaluate most common injuries. Clinical examination helps the doctor assess gait, lower limb alignment, range of motion, and pain points. X-rays help clearly see bone structure, joint space, and bone spurs. Ultrasound helps evaluate the synovial membrane, joint fluid, ligaments, and surrounding soft tissue. Only when these methods are insufficient to clarify the lesion does the doctor need to order additional CORE or MRI. Understanding the diagnostic process correctly helps patients avoid anxiety, avoid unnecessary overuse of expensive diagnostic tools, and focus on early detection and prevention of knee damage from the first signs. For early detection of knee injury risk, it can be divided into 2 age groups. For people over 50, a simple movement such as a squat posture can help identify early signs. When standing with feet shoulder-width apart, slowly lower the body so that the torso is perpendicular to the thighs, and the thighs are perpendicular to the lower legs, if a needle-like pain sensation appears in the knee, that is an early warning sign of osteoarthritis or cartilage damage. If, during the movement, there is a clicking sound or a popping sound without pain, it is not concerning. It is only the phenomenon of gas bubbles in the joint bursting. However, if the popping sound is accompanied by pain, that is a sign the knee has a problem and needs early medical evaluation. For younger people under 50, squatting alone may not be enough to detect damage. In that case, a more subtle method is to squat and move forward in small steps while staying in that posture. If pain appears during movement, or there is a locking sensation making it impossible to step further, then there may be meniscus injury, ligament injury, or synovial membrane issues. These signs are early warning signals to adjust exercise habits, weight, and to seek specialist evaluation. Early detection helps prevent progression to severe damage and prevents waiting until the knee is seriously destroyed, when intervention would be too late. After early signs of knee damage are detected, the next issue is how to adjust and handle things to avoid worsening progression. Many people, when they first feel pain, tend to endure it or self-medicate with painkillers while not changing daily habits and movement. This causes continued overload on the knee and increasingly severe damage. A very important factor is weight control. When body weight decreases, the load on the knee also decreases. Just losing a few kilograms significantly reduces pressure on the knee with each step. Weight loss not only reduces pain, but also slows the progression of osteoarthritis. In addition, diet needs to be adjusted to ensure sufficient micronutrients for the musculoskeletal system, especially calcium and magnesium. A long-term unbalanced diet lacking micronutrients makes the knee more vulnerable, even when activity is not excessive. Along with that, it is necessary to limit factors that increase inflammation, increase uric acid, and disrupt metabolism in the body. Regarding activity, what matters is not exercising a lot, but exercising correctly. Exercises that place high pressure on the knee need to be adjusted or replaced with gentler exercises suitable for one's condition. Moderate walking and exercises that strengthen muscles around the knee without excessive deep knee bending will help the knee become more stable. Many people think that once they have knee pain, they should completely limit all movement. In reality, lack of movement weakens the muscles around the joint, making the knee even more unstable and more painful. The issue lies in choosing a suitable form of exercise that is controlled and professionally guided. For older people or those with clear damage, using assistive devices such as a cane is necessary. This is not a sign of disability, but a measure to protect the knee, reduce load, and prevent falls. Choosing a cane needs to match the user's condition and height to achieve the best effect. In many cases, simply changing the way one walks and stands, daily posture habits, and supplementing micronutrients properly can control knee pain well without invasive interventions. The important thing is that the patient must clearly understand their own pain mechanism and then proactively prevent and adjust. When it comes to using a cane for older people with knee pain, many families still debate and misunderstand it. Some people believe that letting older people use a cane will make them dependent, gradually weaker, and lose the ability to move independently. This view is not correct. In reality, a cane is a supportive device that helps disperse force away from the knee, thereby reducing pain and lowering the risk of falling. In older adults, when the knee has weakened and become unstable, trying to walk without support can easily lead to slipping and falling, fracture of the femoral neck, or other serious injuries. These injuries are far more dangerous than using a cane. Therefore, timely support is necessary and protective, not something that makes older people weaker. There are 3 types of assistive devices often mentioned. The first type is the axillary crutch. Axillary crutches require very good arm strength and physical fitness, and are usually only suitable for young people with temporary injuries. The user must be able to bear almost the entire body weight with the arms, which is not suitable for older adults. The second type is the forearm crutch. Forearm crutches also require relatively good arm strength and are often used for younger or middle-aged people with milder injuries. For older adults with knee pain due to osteoarthritis, this type of crutch is often difficult to use and not effective. The third type is the cane, also called a walking stick or baton. This is the most suitable choice for older adults with knee pain. A cane helps share the load while walking, creates a stable support point, and increases the user's sense of safety. When choosing a cane, there are several important principles to note. First, the cane must be light so that older people can use it easily without tiring the hand. Second, the height of the cane must be appropriate. The ideal height is when the person stands upright. The top of the cane is level with the waist area or the upper edge of the waistband. If the cane is too high or too low, its supportive effect decreases, and it may make knee pain worse. The third factor is that the user must directly try the cane. Only when the older person holds it and feels comfortable and steady is the cane truly suitable. There are many canes on the market with 3 legs, 4 legs, or foldable designs, but not every type suits everyone. Suitability matters more than appearance or advertising. In reality, many older people are still used to using old wooden canes that are simple but fit their hands well and match their gait. This shows that the deciding factor is not whether the cane is new or expensive, but whether it suits the user. From the story of cane use in older people, it can be seen that the most important thing is not which assistive device is theoretically better, but which one fits each person's real situation. Some families buy modern, multifunctional canes, but in the end they are left unused because they do not fit the person's habits and gait. Conversely, some very simple wooden canes make the user feel steadier and more reassured when walking. This is similar to exercising or training for the knee. There is no single exercise that suits everyone. Each body has different structure, different condition, and different level of damage, so the way to exercise and protect the knee must also be different. Applying training methods mechanically without understanding the mechanism easily leads to injury. For people who already have knee damage, current treatments such as physical therapy, painkillers, nerve blocks, platelet-rich plasma injections, stem cell injections, or surgery are only supportive or temporary solutions. When joint cartilage has been damaged, returning it to its original state is very difficult, almost impossible. Some methods reduce pain for a period of time, but then pain may return. Even worse, surgery is necessary in some cases, such as when there are joint stones or bone spurs causing severe compression. But even after surgery, it is difficult for the patient to return to a completely normal state. Artificial knee replacement also has limits in service time. After a period, the artificial joint may wear down, loosen, or conflict with bone, causing pain and limiting movement. At that time, management becomes very complex and much more difficult than in the initial stage. Therefore, the message running through this entire story is that prevention is better than cure. Understanding body structure, understanding the mechanism of knee pain, controlling weight, adjusting diet, supplementing micronutrients appropriately, and exercising correctly are the most important factors for long-term knee protection. With knowledge and preventive awareness, we can keep the knee functioning well into old age and avoid severe consequences that affect quality of life. This is not only an issue for older adults, but an issue for everyone, starting from youth. In summary, knee pain is not a simple issue that only occurs in old age, but the result of many factors accumulating from youth. Body structure, genetics, weight, diet, movement habits, living environment, and even daily lifestyle habits all contribute to this condition. When these factors accumulate without adjustment, the knee gradually becomes damaged and degenerates. Unfortunately, many people only start caring about their knees when pain has clearly appeared, when walking becomes difficult and quality of life is seriously affected. At that time, treatments are only coping measures, temporary pain relief, while the likelihood of full recovery is very low. If each person understood earlier the mechanics of knee movement, understood the role of weight control, ensured sufficient micronutrient intake, chose suitable forms of exercise, and learned to listen to their own body, then many cases of knee pain could be prevented or the progression could be significantly slowed. Prevention is not something overly complicated, but begins with very basic things in daily life. The knee is one of the most important joints in the body, determining each person's ability to walk, work, and live independently. Once the knee is severely damaged, the consequence is not only pain but also dependence, reduced quality of life, and a burden on the family. Therefore, protecting the knee should be considered part of long-term health care, regardless of age. The earlier we start, the higher the effectiveness. Understanding correctly, doing correctly, and doing it consistently are the keys to keeping the knee healthy and making life easier later on.